much for joining in for another space series. Today we have Dr. Ananth Sailoganathan, who is a very renowned educator and academician who have graduated from elite school for his bachelor's as well as master's, and then he went on doing his PhD from Anglia University. He has worked in various capacities, being a founding head of optometry school at Tun Hussein on National Eye Hospital, Malaysia, and he was also associate professor back then in 2022 at Management and Science University. He has been associated with Sri Ramachandra Medical College and University for the last 1.5 years. And today he has consented to talk about fundamentals of outcome-based education for optometry training, especially. Thank you so much, Dr. Ananth Sailoganathan, sir, and the screen time is yours. Over to you, sir.
Thank you, Dr. Gopi, for the wonderful introduction. I hope you can hear me.
You are clear and audible, sir. You can share.
So I just need to share my slide.
Yeah.
Would it be easy if I share the PowerPoint with you, or?
Ananth, on the top, I think just before the leave, there is an option called share.
Yes, it's all hidden.
It's not opening.
Yeah, share is like it's how do I say? It's like the icon is blur. I can't because it's a dummy.
You're not able to.
No.
Do you want to just share your PowerPoint with Gopi?
Yeah,
then he can share it. Yeah.
Because the icon appears dummy.
Yeah. Okay.
I think I have given right now. You should be able to access.
Wait, let me see.
Because
yes.
Yeah.
Now it's okay.
Yeah.
Just a second. Okay. Can you see my slide?
Yes.
Okay. So let me start thanking Dr. Gopi and Dr. Sharanya for giving me this opportunity. So today I'm going to talk on introduction to OBE. So OBE itself is a vast topic on its own, but I'm just going to give a bit of intro. Okay. So the contents for this presentation is going to be number one, why and who are the target audience for the OBE. So basically, we are offering this for the college or university students. So the target audience, as an educator, you'll be targeting for the students and the UGs. Number two is we're going to see an overview about the faculty members in higher education institution at the moment, which is in the Indian scenario or Indian context. And number three is, yes, we will be going into intro of OBE, outcome-based education, then a bit on Bloom's taxonomy. Then I would conclude. Maybe I would take about 30 minutes, 30 odd minutes to complete the presentation. Hope that is fine. So let me start with who we are dealing with at the moment. We are dealing with Gen Z or Generation Z, who are children's or teenagers or adolescents who are born between the years 1997 and 2012. Most of this Gen Z have a very peculiar characteristic, which I'm also facing at the moment. My own son falls into Gen Z category. Okay, so basically they're all highly connected. Let me just take through some of the features or characteristics, typical characteristics they have. Second is they have short attention time. Something you tell them, maybe you have to tell them repeatedly to get an answer from them. They are very good in technology, so they're technology literate. You ask them anything, they can answer within a second. They prefer visual form of communication. They are glued to the gadgets phones and whatnot nowadays. As of course they are used to social media always, most of the time. And what is quite demanding is they demand very fast response from others also. I mean, and they want to be entertained. And the last is they acquire knowledge very fast. Okay, so we as educators are dealing at the moment with Gen Z. Okay, so we have to deal with them in a different way. So let's look at the teaching staff in higher education industry in India. India has approximately about 16 lakh teachers. This is in specific to colleges and universities. That's why I mentioned as higher education institutions. With majority of them being into this category of lecturers slash assistant professors. So we call them as assistant professors. Then we have readers, associate professors who represent about 10% of the total faculty strength, followed by professors and equivalent at about 9.5%, demonstrators at about 6%. Then we have the number of professors has marginally increased over the years, but not much. Marginally, it has increased. Well, now let's move on and let's look at the need for outcome-based education. So, as you all know, India's education system traditionally is rooted in rote learning. So, what is rote learning all about? Basically, we just memorize, mug up, and convert that into an answer, or just replicate or vomit that as an answer in your answer sheet. And also we have a strong theoretical knowledge. Okay, so India needs outcome-based education to address the challenges and shortcomings of the traditional based education system and prepare graduates for the demands of the 21st century workforce. Okay, so I'm not saying we haven't implemented outcome-based education system. It is in action. It is present, but I'm not sure how effectively it has been implemented in India. Well, if you look at OBE in India, was introduced in higher education institutions somewhere around 2013 or 2012, about a decade before. However, the questions which needs to be answered is whether the institutions effectively implement OBE. The second question is, do faculty members diligently practice it? We are not sure, okay, which needs to be looked into. Let me just put my experiences, okay, OB when I was in Malaysia, like what Dr. Gopi just told in the introduction. So I was in Malaysia from the year 2006, and 2007 onwards, I initiated this optometry degree program with Pilani. Subsequently, this was the third program after Shankanitale and Ali Prasad. So we adopted the outcome-based education. In fact, optometry program in the ASEAN, which was offered by our institute, was the first to implement OBE. And the key areas which were crucial for effective functioning and development of an organization, as per the OBE, are listed down below here. As an academician, we need to give equal input in 5 areas. Okay, so let me just go through one by one. Number one is governance. It deals with the institutional governance, institutional organization structure for the body. Then comes the leadership, responsibility, and autonomy of the institution. The third is institutional integrity and transparency. The fourth is the most core or vital is the curriculum. So who are the So who takes the ownership of the curriculum? So basically, it's the faculty members. Okay. So the curriculum, the fifth one is teaching and learning and assessment. Then you have the sixth one, which is student admission and support services, which is managed usually by the admin department or the management department. The seventh is again the faculty and professional staff. The eighth is facilities and resources. Ninth is research and scholarly activities. And the 10th is monitoring, evaluation, and continual quality improvement. Okay. So these are the core areas under the OBE through which we successfully implemented the optometry program way back, I think that was 15 years back in Malaysia. So let's come back to OBE. So let's look at the basic difference between OBE and traditional education. So OBE's instructional planning process is a reverse of traditional education planning. So why it's reverse? Let's look at it now. So what happens in OBE is outcome is selected first before creating the curriculum, instructional materials, and assessments to support the intended outcome. Okay, so what is the outcome? Let's take an example for bachelor's degree in optometry. So a bachelor's degree in optometry will have, say, a set of outcomes. Okay, 1, 2, 3, 4. So basically, to be competent, let me give you some examples here. To be competent in performing primary eye care, that's one of the outcomes. So we select the outcome first before we create the documents, which is curriculum and instruction materials, etc., followed by assessment. So the educational decisions are based on how best to facilitate the desired outcomes. You understand what it means? The educational decisions, that means what needs to be done or what needs to be planned is decided after the outcome has been finalized. So now let's see the difference between OBE. So OBE is always student-centered, whereas traditional education is always or mostly teacher-centered. So you understand what it means, right? Teacher-centered means you just go to the class, you just give a lecture on a topic for about 1 hour or 40 minutes. Then there's no response, there's no feedback from the students. So it's a one-way communication. So you are the lecturer there or an assistant professor or whoever who stands there and just delivers the lecture and completes the lecture session for about 1 hour. And there's no feedback or there's no two-way communication between you and the students. Okay, second point, OBE is outcome-based, whereas the traditional education is objective-based. Okay. The third point is, again, like what I mentioned earlier, OBE is outcome-based. We look for outcomes. Okay. Whereas traditional education is content-based. You get to understand what do you mean by content-based. Say you have a program which is for 180 credits. Let's take bachelor's degree in optometry, and under that program you have physical optics or geometrical optics, which has a credit hour of 3 hours. So you need to deliver that 3 hours, okay, multiplied by so many weeks in a semester, say 15 weeks in a semester, which comes to about 45 hours. So 3 hours of lecture in a week, then you deliver the content. So basically, traditional education is content-based. So basically, you start OBE by beginning with the end in mind. So what does this statement means is begin with the end in mind is your ultimate objective or goal is to produce an optometrist who has a good clinical competency in addition to XYZ, okay, and has a very holistic approach of optometry profession. But what happens in traditional education? We begin with what is to be delivered. Okay, you as a lecturer, for example, given a module or a subject to be delivered, okay, for the semester 2 students or semester 3 students. So you just take the course material or the curriculum from the program leader or the course coordinator and you just deliver it. Maybe you might not be aware of OBE. Also, you just go by the traditional educational methodology. So that's a basic difference. Okay, now let's look at the definition of outcome-based education. Outcome-based education is a student-centric teaching and learning methodology in which course delivery, assessment are planned to achieve stated objectives and outcomes. So you see how clear and explicit the definition is. OBE focus on OBE focuses on measuring students' performance, that is, outcomes at different levels. So, what this means is across the semester, you have internal assessments, okay, assessment one, assessment two, assessment three, or then you have the final examination. So, that's what it talks about, okay. So, there's a continuous assessment and which on goes throughout the semester. So I have another definition here by Tucker in 2004. He has stated that outcome-based education is a process that involves the restructuring of curriculum, assessment, and reporting practices in education to reflect the achievement of higher order learning and mastery rather than the accumulation of course credits. Okay, I did mention earlier about traditional education. That's what it means here. So a point to note is higher order learning, and also rather than accumulating course course credits, you just ponder and learn about what is implemented in outcome-based education to achieve the outcome. Okay, let's look at what OBE could do. OBE addresses the following key questions. We have 4 key questions here. Let me start with number 1. What do you want the students to have or able to do? Very simple, right? We want the students to gain knowledge. We want the students to perform the skills accurately. And of course, we want them to be in a position to solve complex situations or problems. Okay. Question number 2 is, how can you best help students achieve it? By implementing student-centered learning. How we can implement student-centered learning? By implementing the technique of outcome-based education. Question number 3 is, how will you know whether they have achieved it? Through various assessments. Assessments doesn't mean you just need to conduct tests or written examinations all the time. Try to be innovative, okay? Try to give them some, how do I say, leeway, okay? So that maybe they can showcase the presentation skills, they can showcase the uh, other soft skills. So one assessment could be a written test, the second assessment could be a seminar presentation, for example. The third could be a assignment, okay, based on a field visit. So assignment based on a field visit. So that's called as a reflection report or reflective report, okay. And the final assessment could be a written examination, okay. And the fourth question is, how do we close the loop for further improvement? This is very, very important, okay. We call it a CQI, continuous quality improvement, which means that once an institution has run a cohort of students, a batch of students who have completed the program, year 1, year 2, year 3, year 4, and they have graduated successfully. So what we do is we do a SWOT analysis, SWOT analysis, to get the feedback from various sources. Where do you get the feedback from? You get the feedback from the students. You get the feedback from the stakeholders. Yes, okay. You get the feedback from other parties, okay, who are directly or indirectly involved with the academics. Okay, so that's how you improve the quality of the program as you go along. So now let's look at some of the important aspects of outcome-based education. So I've listed down some key terminologies here. Okay, vision. What is vision? Vision is basically a futuristic statement that an institution would like to achieve over a long period of time. So you need to be very careful in devising or planning to devise what is a vision of an institution. The second one is a mission, is a public statement about what a particular institution values and how those values shapes the goals, the purpose, and the actions of the particular institution. Now let's go into the program. Okay, number 3 is program, defined as a specialization or discipline of a degree. So we are talking here about optometry degree program. It's an interconnected arrangement of courses. Courses means subjects, co-curricular or extracurricular activities to accomplish predetermined objectives leading to the award of a degree in that respective discipline. Now let's go into a bit more of detail on OBE. So we have something called as a program learning outcome. The short form is PLO. So PLOs are narrower statements that describe what students are expected to be able to attain or do at the time of graduation. Okay, so it relates to the skills, knowledge, and 3, the behavior that the students acquire through the completion of the program. And it is expected to be aligned closely with the graduate's attributes. Okay. Next, we have the program educational objectives. So please don't confuse. That is PLO, which is learning outcome. This is PEO, or we can call it as PO also, program objectives. Program objectives are the statements that describe the expected achievements of graduates in the career, and also in particular, what the graduates are expected to perform and achieve during the first few years after graduation. Okay, so once the students have graduated, we will learn about the program educational objectives. Then we might tweak the program educational objective to suit the program outcomes accordingly. The next terminology is nothing but the course. Course is defined as a theory or a practical or a theory come practical subject studied in a semester. Next comes the course learning outcome. The short form is CLO. CLOs are basically statements that describe significant and essential learning that students have achieved and can reliably demonstrate at the end of the course or the subject. Okay, so course learning outcomes are specific to a particular subject. So if you take ocular diseases, you will have 3 course learning outcomes, 1, 2, 3. Okay. Likewise, we have what I haven't mentioned here is likewise, we also have what is called as a topic learning outcome. Within the course, like ocular diseases, 1, you will have a topic on diseases of the lids. Okay, so for that particular topic, you need to specify the topic learning outcome. Usually, topic learning outcome depends on the number of credits. Okay, the course learning outcome also depends on the number of credits, the weightage. Ideally, we'll have 2 or 3 learning outcomes for each topic. And the last but not the least is the mapping, or we call it as alignment. So we align the objectives with the outcomes, which is the program, the course level contents. OBE tends to map at different levels by aligning itself to what is called as Bloom's taxonomy of 3 learning domains. So we have 3 domains of learning, which is cognitive, affective, and psychomotor. Okay, all these 3 learning domains apply to all the programs universally. Okay, so then we have the rationale. Rationale is nothing but a short description that makes clear the purpose and necessity of the subject as such, which you're delivering. And it also describes the basis and the context to understand how this course supports student learning and how it fits in the wider curriculum. Okay. The last one is graduate attributes, attributes that are expected from a graduate from the program. Okay, what do you expect the graduate to achieve? So that is a graduate attribute. Well, to put it in a nutshell, I've listed down some of the major benefits of implementing outcome-based education. Number 1 is OBE makes the program student-centric. Number 2 is OBE makes or gives way for better tracking the learning in students. Okay, so we can track the students at which level or what stage they are when they are in the semester. It engages with students in a better way, and it is more directed curriculum and reviewing and revising. That means what it means is we have a curriculum and we need to review it consistently. It doesn't mean you need to review it every year, maybe once in 3 to 5 years, okay, to suit the needs and the market environment. It provides a better assessment modality, and the last is it meets accreditation requirements. Okay, so we are talking about the NCAHP. Okay, I think in the very future, and a couple of years. So I believe NCAHP would strongly implement accreditation standards. They've already given some guidelines. Okay, but I believe they would stick to the some of the norms which also complies with the OBE. So having said so, let me just take through on about what is Bloom's taxonomy is all about. So what is Bloom's taxonomy all about? Okay, the name comes from Benjamin Bloom, who introduced this model. It is a set of 3 hierarchical models used for classification of educational learning outcomes into levels of complexity and specificity. Okay, uh, this was introduced by Benjamin Bloom in 1950s. Subsequently, in 1990s, his co-workers, basically students, improvised the Bloom's taxonomy and introduced a modified Bloom's taxonomy, which we commonly use here. Okay, so let's look at what is it all about. So I did mention earlier Bloom's 3 domains of learning outcomes, which is cognitive, affective, and psychomotor. So what is cognitive domain? Cognitive is the most basic. That means what the student need to gain. Student needs to gain knowledge, intellectual capability, to put it simple. Okay, knowledge. It's all about knowledge. So that's a cognitive domain. Second one is psychomotor domain. Okay, here comes the psychomotor domain because why? It directly deals with optometry because we students need to perform various skills, various procedures to improve the competency. Okay, so psychomotor domain plays a very equal importance in optometry. And the third one is affective domain. Affective domain, I'm not sure whether all students possess this, but they need to have this. It's about feelings, emotions, behavior. So the attitude is a big problem which we face now with the current students, the Gen Z or the 21st century students. So they have a very bad attitude towards the patients. I'm not blaming all the students, but a percentage of students. So we need to have an equal mixture of all these domains in the student population, among the students. Okay, just to recap, what is the advantage of Bloom's taxonomy is number 1, it defines the learning outcomes. Number 2, it defines the educational objectives. Number 3, it selects a teaching method or strategy which is very clear and can be easily implemented. And also, it also gives ways and means of selecting the teaching materials. Okay, say for example, if you have a topic on ocular anatomy, you want to demonstrate on the anatomy of the orbit. So what you need to do, you simply is you just do your PowerPoint presentation as a lecture, followed by a demo presentation. Take an eye model of the orbit, okay, then explain it to the students, make it more interactive. Okay, so that's one of the means of implementing the OBE. That's a classical example. Number 5 is preparation of assessment tools. I told you earlier, various assessment tools. Try to be innovative. Please don't micromanage the students. Okay, so please give a leeway to the students, make them feel free. Okay, in that way you feel more relaxed, and also you give them some leeway for the students to breathe. Okay. 6 is development and review of the curriculum. So these are the advantages of Bloom's taxonomy. So now let's look at these 3 domains. I've given an example here. Let's look at the cognitive domain. So what is cognitive domain is all about? It's about students' ability to process information in a meaningful way, which simply means that students need to demonstrate knowledge and comprehension on a specific area or a specific subject or a specific topic which relates to real life scenario. So basically, student needs to gain knowledge on that particular area. Okay, so it could be mental skills, it could be comprehension, or it could be also critical thinking. It depends on which level the student is. Okay, from year 1 to year 4. Year 1 and year 2 usually is about knowledge. Year 2 is comprehension, maybe knowledge and comprehension. Year 2 and 3 onwards is critical thinking as they go along with the program. Then we have the second domain, which is affective, which is nothing but students' attitude and feelings from the learning process. So it involves the demonstration of feelings, attitudes, or sensitiveness towards other people. Okay, it includes the manner in which we deal with things emotionally, such as feelings, values, appreciation, enthusiasm, motivation, and attitude. Okay, this is directly related to the patients. Okay, your colleagues, students, colleagues, faculty members, and the patients as such. So that's the affective domain. Then we have the psychomotor domain, which is students' ability to use motor skills to learn. Psychomotor domain measures the skills performance of student. Performance required will involve manipulation by using various gadgets or equipments. Okay. Well, to summarize on Bloom's, so Bloom's taxonomy classifies educational learning objectives into levels of complexity from basic recall to higher order thinking. Like I've listed down here, you look at this triangle here, okay, from bottom to the top. So it starts from the bottom. So it allows the students to remember, then subsequently to understand the concept, apply the concept. If it requires to analyze, the student goes ahead and analyzes the scenario, subsequently evaluate the scenario, and the last one is create or synthesize. Okay, so when you talk about year 1, it's all about remember and understand as they go along, as they build up, go up the ladder. So they apply the knowledge which they learned or which they understood, then analyze, and evaluate is a classical example is you give a case scenario or a case presentation or a grand round, you tell them to evaluate the patient, the situation. Okay. Then create is nothing but you synthesize what is the outcome of your case which you're dealing with. Okay. So it helps the faculty members to design learning experiences and assessments that encourage deeper understanding and critical thinking. Okay, so this is to put in a nutshell. I'm not going to go into details of all this, but you can just you can get this information online. Okay, so I've given some examples of teaching methods which you can implement as educators. I've done for all the 3 domains. For cognitive domain, I'll just go through 1 or 2. If the student wants to understand a concept, what you need to do, you tell them to give a reading text or tell them to refer to a reading book, textbook, for example, or a text or an online resource material for them to read in addition to your lecture notes. Okay. Okay, let's look at analyze. Cognitive domain, analyze. So how we can achieve it? By giving problem-based learning, case studying, brainstorming is a good idea. And the third example is evaluate is how do you evaluate the students? By giving an assignment, maybe have a discussion forum, or you give a review work, which is nothing but when the students are in the final year, say, you can give a journal article for them to critically review the literature or the article and come back to you and present it. Okay, so that in that way, you could evaluate the cognitive domain. The second one is teaching methods on the affective domain. Okay, so let's take one example here. Responding. how the student responds, how the student reacts to your method of delivery. It could be a lecture, a group discussion, cooperative learning, which is not happening here. Okay, field trips, field visit. I did mention that. Okay, or a simple question and answer session. You want a response from the student. You don't know whether at what level the student is. You can implement all these techniques in addition to lecture. Okay, organizing. Another example is organizing. Go on a field trip, discussion forum. Role play is very important. Okay, so you can implement role play also as part of the OBE affective domain. And the third one is psychomotor domain, which is, let's take one here, precision, practice, 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 which we all do, okay, in the field of optometry. Review your practice, get the feedback from your superiors or the supervisor, practice to improve your competency before you graduate. You in the sense before the students graduate under your able leadership of educating them. Well, so in conclusion, I would like to conclude that the need for OB in India stems from the limitations of traditional education system in adequately preparing the students for the challenges and opportunity in the 21st century. And by adopting outcome-based approach, India can foster a more relevant and skill-oriented and globally competitive education system that will empower the graduates to improve or enhance innovation, economic growth, and finally social progression. So what is my take-home message? So my take-home message would be those who are keen on coming into academics, those who are keen to become educators, those who are keen to become academicians, please have a passion for teaching. Okay, number one. Number two is, as we are in a clinical degree program, so you need to be, first and foremost is you need to be a good clinician. That doesn't mean you need to stop uh, seeing patients. You need to have your clinic running side by side. Either you're seeing the patient on your own or you're supervising the final year student. Doesn't matter. Okay, so please stay in touch with your clinical work. Okay, so clinical work will go hand in hand with your academics. The third one is to have, I'm not sure whether we have this in India, but we need to have a mandatory certification in learning and teaching, or we call it as pedagogy. Okay, so this is a training or a certification program which runs for about a year, 2 semesters on a part-time basis. Okay, this will enhance or equip educators. Okay, uh, or academicians to stay abreast about latest teaching techniques and methodologies used in current date. And the last one, which we all miss out, is lifelong learning. So if you want to keep yourself up to date or updated, so we need to keep on improvising our knowledge, okay, to know what is the recent trend in the current scenario in the outside world. Okay, I would like to finish my presentation by mentioning a famous quote by Benjamin Franklin. He says, the quote goes like this: tell me and I forget, teach me and I may remember, involve me and I learn. So I believe we all should involve the students so that they can effectively learn and become a better graduates to serve the nation at large. Okay, so with this, I would like to end my presentation. I would like to thank again Dr. Gopi and Dr. Sharanya for giving me this opportunity. Uh, and thank you, everyone, for joining with me here.
Thank you so much, Dr. Ananth. In fact, we have a very focused group today, mainly faculty members. Most of them are faculty members. And I do
That's
see
great.
our postgraduate students who are very interested to take up academia as their
That's great.
so I think this is a very nice way of start their academia, and also it was a very refreshing session where I we were doing all those hobby bits and parts.
Yeah,
In fact, I am doing it as a part of my teaching learning aspects, but we have never thought or put up in a framework like this is what we are doing. So that was very interesting, and we do have a couple of questions. One from Saranya ma'am itself, like over
sure.
to you, ma'am, if you want to give it.
Yeah, thanks, Ananth. I'm not sure if you know, I'm currently pursuing my PhD work on employability skills
Okay,
for
congratulations.
optometry graduates. Yeah, thank you. So in as part of that, one of the employability skills that we're looking at, one aspect is in education, in
Okay.
academia. So
Mm,
so we are looking at, first identifying the skill sets and then transferring those skill sets, seeing if we yeah, sort of, give an input, we want to see how the results are in
yeah.
terms of employability. So I'm looking at training master's students for teaching, learning, pedagogy kind of situation. So what would
Yeah.
you suggest in your experience, the best way to sort of train the students for the teaching, learning? Because like you said,
Okay.
I don't find certificate courses or certification here. So
Mm,
what is the best way for us to do it? Because we're trying different things, Gopi and I sit together and we say, okay, let's try this, let's try that. And some things work, some things don't. So in your
yeah.
experience, what works and what would you
Okay.
suggest?
Okay. In my experience, like what I did for my faculty members is we employed a consultant from outside um, who was who was quite well known and kind of like was we had classes over the weekends on a Saturday and I think not a Sunday, maybe Friday afternoon and Saturday for a couple of hours, and he designed the modules for us. So what you can do is you need to look for someone who is specialized in this area, um, and basically get his or her input. Maybe I mean I would suggest to get someone who's yeah, a consultant to come over and deliver this content. I mean, it's not necessary that that person has to be physically there all the time. And this contents can be delivered online also nowadays. It can be on a hybrid mode. Uh, I would be happy to share. I mean, like because I've done this module in the past, I would be happy to share some of the contents with you. Yeah,
Sounds absolutely great.
yeah,
I think Gopi and I will get in touch with you with regards to
sure,
this,
sure,
and
sure.
then we'll take it further.
There was one question by Dr. Vanarmati during registration.
Yeah,
Her question was, what strategies needs to be adopted to effectively implement OBE? Maybe we do have multiple universities across India and private deemed to be universities, also the government
yes.
institution. In fact, I am also in line with that question because
Mm,
we do have a pressure of completing the portion on time and conducting a lot of internal exams, which we have to
yeah, yeah.
provide. So we have to when we try to balance it out, something goes away. So do you have any thoughts on that?
Yeah, I think like Gopi, what you said, your answers and your question itself. So now at least we will be having hopefully in the coming years we have this common curriculum based on the NCHP, so which we need to adopt. And based on the common curriculum which is being proposed by NCHP, we need to come up and devise. Maybe we need to form something. We had this in my experience. We had this in Malaysia. We had a head of optometry program council. So all the heads used to meet. Then we used to brainstorm and come up with the modes and modalities of various the methods of delivery and assessments and so on. So I think there are a lot of heads needs to be put together. A lot of brainstorming needs to be done, and we need to. It's not like it's a teamwork. I know it's going to be a daunting task, um, like what we are looking at from 2026 onwards. But we need to start somewhere for us to achieve it. So yeah, I think we need to work as a team, and maybe a representative, maybe one or two representatives from each institution, to maybe we could meet, or not necessarily physically, maybe online. Then we just come up with a common kind of modality of teaching and learning, which could be implemented, hopefully, uh, for the UG program. Maybe first we start with the UG. But as far as the OBE is concerned, it's up to the faculty members. So, I mean, I've had these experiences in the past. So, bringing them together, giving them the task is easy, but to get the task, to get it done is going, it was quite challenging. So, we need to set targets, we need to set deadlines, uh, because the enforcement where I was very powerful. So, if you don't stick to, or if you don't comply to the guidelines and we call the requirements, then the institution will end up losing the license. Okay, so here I believe so. Once we have this council in action, maybe everything would fall in place, but it's going to take some time. Yeah, but ultimately it starts at the level of the department, okay, from the faculty members. Yeah.
Okay. I think we have one last question from even Saranya ma'am. Like, how do we
Yes.
assess the efficacy, or how do we audit the efficacy of OBE in like maybe every 6 months, or how often we have to audit or look at the efficacy of OBE? Is there any way we can do it?
We have a metric for it, so we can assess it after every. I mean, if we're going to do it every semester, it's going to be cumbersome, but we can measure it. We have certain set of rubrics. We can implement it, and we can audit it. It's not a big, how do I say, it's doable. Yeah, but it requires a dedicated person who could work on this. Okay, in addition to academics, the person has to be preferably an academician, who is kind of a well versed in this area, in this field. Yeah. So if you can do it once a year, be just great. Or once a semester, it's be wonderful. Yeah.
Okay, so it's better to have an independent person to assess the like do the audit, or can the person be part of the
Yeah.
organization?
It can, the person can be part of the organization. Person can be part of the organization, and if required, I'm not sure whether here whether we require external examiners. We could invite an external consultant to come in and audit. Yeah, but usually we start with internal audit first. Yeah,
I think
yeah, that could be done after a cycle is over. I mean, after one complete cycle, after a 4-year program.
okay, okay. I think we do not have any more questions due to the time, and I would like to
Sure.
thank Dr. Ananth sir. And we do have a certification for these from OCA. If participants can take up the form and fill it up, we will circulate it as soon as possible once you complete the assessment form. And thank you so much, Dr. Ananth, for your time and giving us a bigger part of OB in a very nutshell this crisp time. And do you have any thoughts, comments, ma'am, Sanyam, or shall we close?
Oh, it's an absolute need, appropriate talk, very much at the need of
Yeah.
the hour. So thank you so
Yeah.
much.
Yeah.
Really
Sure. Sure.
enjoyed it.
Thanks. I think I've just covered only about how do I say 10 or 15% of OBE. So we haven't.
Yeah.
This is just an introduction. Maybe subsequently, if I'm given an opportunity, then maybe I will just continue with on the various other aspects of OBE. Then we can talk about implementation also.
No,
Thank you.
we'd love to. We'd love
Yeah.
to.
Thank you, Gopi, Saranya.
Thank you.
Bye.
Thank you.
Thank
Have a
Bye bye.
nice
Bye.
day. Bye
Bye.
bye.
Thank you.
Have a
Thank you
nice
so
day.
much.
Bye.
You too.